Tonight, some nurses at Desert Regional Medical Center say the hospital is not doing enough to protect them from coronavirus.
They contacted the I-Team and I took their concerns straight to hospital officials. They don't want to show their faces.
Management tends to retaliate against the people that do speak out.
But these 3 Desert Regional Medical Center nurses say their message needs to be heard. Their claims are alarming.
We have a lot of nurses that have been hospitalized and are in hospitals because of COVID.
And you blame the hospital for this?
100%.
Yes.
Their main concern, issues with personal protective equipment or PPE.
Place your N95 mask in a paper bag labeled with your name. According to the CDC, the mask can be reused for your entire shift.
They sent the I-Team this YouTube video from the hospital instructing staff how to properly handle PPE. But the nurses say the PPE is often reused for multiple shifts and point to this photo they took inside the hospital of a room containing marked paper bags.
We even kept these things in paper bags, sometimes days on end.
They also say the hospital's PPE does not always fit properly, including this plastic gown not fully covered by the apron, and limited masks in limited sizes.
They won't supply us with N95s that work, that fit us. So now I'm left buying my own PPE.
You're buying your own PPE?
Yes.
Have you voiced these concerns to your management?
Yes, we have. We have multiple times, and we're just getting no answer.
But I got answers from Desert Regional's Chief Operating Officer, Mike DeToro. First off, is there or has there ever been an outbreak of coronavirus among nurses and staff?
We have not had an outbreak. We're like any other healthcare or community member, we are susceptible, like the rest, to have this virus.
DeToro says employees are tested. He says the positivity rate below 10% is a testament to the safety efforts they have in place. And if an employee is sick,
it's a policy here that if somebody is positive or symptomatic, they are immediately sent home and they are not allowed to return to work unless there's been 10 days since their most recent positive test or 10 days since their first symptoms, and they must have at least 24 hours of fever-free at the end of that 10 days, as well as the symptoms must be markedly improved.
But the nurses tell a different story.
They're coming back positive and exposing everybody that's at work, including patients.
So you're saying the hospital is forcing nurses who test positive for coronavirus to come to work?
Come to work. As long as you don't have a fever, you can come to work.
Should patients be concerned as well?
Absolutely.
That's not true. We're following the recommendations on the quarantine, as I've stated, and patients are not at risk because of this.
And when it comes to PPE?
The safety of our staff, of our physicians, of our patients is first and foremost in what we do. It's first and foremost in our decision-making with our PPE strategies. We have assembled a team and asked a group of our physician leaders to help follow the guidelines and recommendations from the governing bodies that give us recommendations on PPE use.
We've reported a lot of things to the Department of Public Health. I think many people have called Cal OSHA.
There have been to date 25 anonymous complaints made from nurses to either the California Department of Public Health or Cal OSHA regarding our PPE supplies and how we're using it. These bodies are mandated to come and investigate every allegation or any complaint that is made. And to date, all 25 have produced no deficiencies. And we have found out from these visits that in many ways, we're exceeding the recommendations made by the governing bodies. And we feel this validates the hard work that our team and our physician collaborators have put together to keep our folks safe.
Is reused PPE being stored at the hospital in paper bags, sometimes for days on end, and is it safe to do that?
That's not happening. Any employee that comes in or physician is given a new mask with every shift that they're here. And that's consistent with the strategies that these governing bodies are asking to extend use of PPE, but they get one with every shift. There are paper bags, and the paper bags are used if somebody's going to take their lunch break. You obviously cannot eat with the mask on. So the opening of the paper bag offers a cleaner environment than taking your mask and just setting it down on the table. So we do a new mask with every shift, and at any point, if a mask becomes soiled or the integrity is thought to be compromised, we give a new mask. And it's our expectation that the folks let us know so they can get a new mask.
I showed DeToro the nurse's photo.
Can't really comment where that is. And the policy that we have is very strict that you get a new mask every time you come in.
Are nurses buying their own PPE, and is the hospital allowing them to wear their own PPE, or will they get in trouble?
Now, we have adequate supplies of masks and PPE, and we want the folks to use the supplies that we have, because we know where we've gotten the masks from. We know that they fit appropriately. We know that they're recommended by the governing bodies. And so we want folks to use the supply that we have, and we have enough. We do have the PPE that fits properly.
The nurses union recently rallied outside the hospital, demanding more PPE and safer working conditions. About 200 similar rallies were held at hospitals nationwide. So, sir, let me just ask you point blank, are the nurses lying, or are their concerns valid?
Yeah, I can't answer that question. What I can say is we feel confident that we're doing the appropriate things to keep our nurses, our frontline caregivers safe.
We're supposed to protect them. We're supposed to protect our patients, our communities. That's what we're here for. And we're letting them down.
What is the message you want nurses and staff and also the public to hear about what's happening right now at Desert Regional?
Safety is the top priority for us, for any member of this organization, whether it's our staff, our physicians, and our patients that come into this building. We're very proud and we're thankful for the work of our frontline caregivers. What they've done to pull together through this is nothing short of miraculous.
The nation's largest union of registered nurses, National Nurses United, recently delivered a petition to Congress with more than 500,000 signatures demanding legislation for more PPE. The union is also asking the CDC to strengthen its guidelines on PPE to force hospitals to do more to protect nurses and staff. Desert Regional said it values all of its nurses represented by the union, but is disappointed by the union's rally. Meanwhile, the number of coronavirus patients at the hospital has dropped significantly in the last month, from more than 90 patients to now less than 10.